Well, good morning, everyone. Pandemic safety policies are back atop page one these days, and the lead story on the local news with the surge of a highly infectious COVID variant and increased numbers of infection and hospitalization here in Massachusetts and around the country, even as the pace of vaccination slows. Let's get some perspective on this from our guest who straddles the worlds of both public safety and medicine and politics. He's Dr. Jon Santiago, state representative from the South End, and up until earlier this month, a candidate in the Boston mayoral race, and of course, an emergency room doctor at Boston City Hospital. Representative, thanks for joining us.
Great to be here, John.
So what are you seeing in the ER over recent weeks, and what does it tell you about what we need to be doing about it?
Well, up until recently, we had seen quite a bit of lull with respect to COVID-19. I would go in for a shift and I would rarely see a COVID-19 case. I will say over the past week or so, I have seen a couple of cases, but the vast majority of them have been from folks who have been unvaccinated. I mean, as you know, John, 97% of cases of hospitalized COVID-19 cases are from patients who have not been vaccinated. But I have seen a breakthrough case now and then, and that's the big concern moving forward, given the fact that the Delta variant has taken over this country nationally.
So you know the debate that's going on as we were taping this. By the time it airs, he may have come out with a more definitive statement, but Governor Baker was saying, I'm going to review the CDC advisory and review all the data and come up with a decision. But he was sounding like he was reluctant to reimpose mandates, a mask mandate, for instance. Should he?
Well, I think Governor Baker has a fair point. The state of Massachusetts is at a different place from the rest of the country. We're number one and number two in the nation with respect to vaccination. Almost 63% of residents here in the Commonwealth have been vaccinated. But it's important to note that there exists significant inequity when it comes to vaccination across the Commonwealth, whether it's communities of color. And as we know, the Delta variant right now, the concern is that it's infecting people who have been vaccinated. And although they have been vaccinated, they could be asymptomatic and be transmitting the virus. So that's a big concern moving forward. The CDC has decided to move forward with certain recommendations. Number one, if you are vaccinated and in indoor crowded spaces, you should be wearing a mask, which I agree with. Also, with respect to schools, here we are going to open schools in the fall in a matter of weeks, and you have close to 900,000 under 12-year-olds that are going to be entering crowded indoor spaces, and they should be vaccinated as well per the CDC, and I would agree with that.
Should they all be masked?
Well, that's what I meant, masked, not vaccinated. Now, obviously, I think that we should be moving forward with the vaccination. Now we have an opportunity moving forward now. As you know, when the vaccination process was open up to the Commonwealth, it got off to a pretty bumpy start. We were able to massage the difficulties, and we're at a good place right now, but we need more with respect to equity. But my hope is that when the FDA authorizes the vaccinations for children under 12, that we move forward and giving local public health officials the opportunity to get children vaccinated as soon as possible.
Well, we got to take our break in a moment, Representative, but given all that we've been through, and you see the intensity of the rhetoric on the right, you can hear it on the right-wing talk shows here in the Boston area, about how talk of remasking is ridiculous and this is all being overblown and Dr. Fauci's a liar, et cetera, et cetera. How difficult is it going to be to get people to comply with public safety recommendations?
I think it'll be quite difficult. My hope is that we can move forward in a way that takes the public health into account here. My friends and my colleagues and the people I work with at the hospital, we understand what's happening on the front lines. We see what COVID has done. It's ravaged a healthcare system. We've done so much to come out of this pandemic, but we're still very much in the thick of it. And the future, the next couple of weeks, will be very pivotal in how this state and how the city move forward. But my hope is that we can get folks vaccinated as soon as possible with respect to kids under 12, and that we continue to tackle those vaccine equities that are still staring us in the face.
So this is no joke. This is no hoax. This is not exaggeration by the public health establishment. You're worried, and people should be worried and concerned.
We should all be worried. Absolutely, we should all be worried. This Delta variant, I mean, if you think about it, early July, the Delta variant made up about 50% of cases. Now we are still near the end of July, it's up to 83% of cases. This is a strain, a variant that is much more contagious, that is much more virulent, and we're having breakthrough cases. And the fact of the matter is right now, for example, I was vaccinated last December, and how long my immunity is going to last, I don't know. Now there's conversations with Pfizer and other companies that are potentially looking at boosters and studies to investigate that. But the fact of the matter is right now, we know what works. Masking works. And in the case of crowded indoor places, we likely should be masking.